Hi, I'm Dr. Siddhartha Chakravarthy. Are you worried that your calcium levels are high? You went for a regular health checkup and you're perfectly fine. And you see the reports and you realize that your serum calcium levels are above the upper normal limits. So today we are going to discuss about the common cause for high calcium level and what you are supposed to do when you have high calcium levels. Whenever you have high calcium levels, the common things that the doctor has to rule out is that you are not taking any calcium medications that can increase the levels of the calcium. We also check whether your vitamin D levels are normal and you are not taking too much vitamin D, which can also cause high calcium. The other most common cause for high calcium is when you have a problem with your parathyroid glands. Now, what are these parathyroid glands? So parathyroid glands, we have 4 parathyroid glands in our body, and this is the thyroid gland, and behind the thyroid gland here we have 4 glands. These are called parathyroid glands. These parathyroid glands are usually around 3 to 4 millimeters in size, like the size of a tur dal, I could say. So these glands are very important to maintain the calcium homeostasis in the body. Whenever there is an abnormal growth or a tumor in one of these parathyroid glands, then the parathyroid, the PTH or the parathyroid hormone levels in your blood will be high, and this high parathyroid hormone levels will act on the bone and remove the calcium from the bone, and this excess calcium is what is represented in your blood. So when you check your calcium levels in the blood, they'll be high. And what will happen? What are the symptoms that you can develop, or what are the problems that you can develop if the calcium levels are high? When your calcium levels are high, this excess calcium has to be flushed out from the kidneys. So when the load of the calcium becomes high, you can develop stones in your kidneys. Around 30% of the patients can develop kidney stones. And when this calcium level is high, it can act on the central nervous system or in the brain, and some people say that I think I have some memory issues. I'm forgetting what I used to remember earlier. Or some people will have a cloudy sensation, and some patients have depression or anxiety. These high calcium levels can act on the stomach and produce more acid. So patient complain of acidity, that's a gas problem, and they keep taking over-the-counter antacid pills. This high calcium can also cause constipation. So some patients have constipation. Not all patients are affected the same way. Everybody's body responds differently to the high calcium levels. And fortunately, less than 7% of the patients develop acute pancreatitis, where the pancreatic gland becomes inflamed, which causes severe pain in the abdomen. As time goes on, the bones become weak, and you will develop severe osteoporosis, and you will even get a muscle weakness and tiredness, so you feel lethargic. So these are the common symptoms of primary hyperparathyroidism, where you have a tumor in the parathyroid glands, which causes high PTH, which in turn causes high calcium. That is what you pick up when you go for a regular health checkup. But don't worry, this is not a cancer, and it's a curable condition. In my next video, we are going to discuss the evaluation and the treatment options for the same. Thank you.